And welcome to your lecture on medications affecting the immune system. Our objectives are similar to each area: therapeutic, pharmacological action, side and adverse effects, proper technique, and recognizing needs for education and interactions that cause adverse reactions. So immunity. What is immunity? Active immunity is going to be permanent. So the body itself possesses the antibodies. This can occur naturally or artificially. In the natural active, this is when antibodies are created in response to environmental exposure. So I was exposed to a virus. My body is now familiar with the virus because it has developed antibodies, and hopefully I do not acquire it again. Artificial active immunity is when antibodies are created to a response, such as vaccines. So before you are exposed, you are giving a vaccine to artificially provoke your immune system to attack. Passive immunity is only going to provide immunity via temporary means. This is when antibodies are given to the body. This can occur also naturally or artificially. Natural passive is going to be when antibodies are passed from the mother to the fetus through the placenta or through colostrum and breast milk after birth. Artificial passive immunity is going to occur when antibodies are created into response, such as with immunoglobulins. So this is going to protect against after you have been exposed, whereas artificial active is prior to being exposed. Vaccine administration. This is going to be through the IM route for most administrations of vaccines. There are some that are oral for the infants, but other than that, most of these are going to be administered via IM. So with infants and in children, we need parental consent. We cannot give a vaccine without the consent of the mother or father or whoever has custody of the child. The site is going to include the vastus lateralis or ventrogluteal muscles for infants and children. The deltoid is only used in older children. That muscle is not large enough to receive any medication that is not negligible. It can hold very little milliliters. When we are providing a vaccine administration to a child or an infant, usually we have to provide a distraction. That needle is going to be kind of scary. They don't know what it is, if it's the first time they've seen it, or if it's not the first time they've seen it, we need to provide a distraction for them. Sometimes we can, if we have the opportunity and time ahead of time, we can apply a topical anesthetic to the site prior to the injection, such as like the EMLA cream we talked about in first week's lecture. We can also provide oral sucrose prior to injection. So this is like sugar water. We can give them to their mouth so they can suck on that as a distraction and have a happy response to the situation that's going on, or even dip their pacifiers in it. We're going to give them a lot of praise afterwards. Good job, you did so good. You're such a big boy, such a big girl. So that you acknowledge the effort and their bravery and that everything is what is expected, so they don't have to worry. Give them a colorful Band-Aid and educate the parents that to not give aspirin for any type of reaction or irritability or any mild temperature increase that they may have afterwards, which is a normal response to the body reacting to what was just given to them. We're provoking the immune system. But remember not to use aspirin because of the effect of the Rey syndrome. In adults, some medications, vaccines, we can give through the sub-Q route. And in that case, we're going to do it to the upper arm or the anterolateral thigh. So the top surface on the outside of the thigh. And then IM, we're going to give through the deltoid muscle. No matter the age, all of them We're going to make sure that we have emergency equipment on standby in case there's a severe allergic reaction, that they have been provided with and understand what the vaccine is. And so this is usually given through the vaccine information sheets that are provided by the CDC. We're also going to notify the primary doctor of any complications and document the date, route, site, type, the manufacturer, the lot number, and the expiration date. These need to be in place every time they get a vaccine. The lot number, expiration date, and the manufacturer, so that if anything was to happen and there seems to be a correlation between the lot, then we know who to notify that they may get these symptoms, that like 50% of those that were administered with the medication from this lot number have had this reaction, to be monitoring for that. Also, of course, we always need an informed consent from either the patient themselves or the parental guardian. Vaccination concerns. Anaphylactic reaction, immunocompromised, and risk versus benefit. So anaphylactic reaction is closing the throat, inflammatory over response of the immune system, similar like an allergic reaction. This needs to be treated immediately and try to prevent the airway from completely closing. So often this means that we're going to save the airway by intubating them before their airway becomes completely compromised. In individuals that are immunocompromised already, such as those who have cancer or taking immunosuppressants, live vaccinations are going to be a very concerning situation. They should not receive live vaccinations, so we'll go into the difference of these vaccinations in just a moment. So immunocompromised individuals need to be wary and educated appropriately on their vaccines and their vaccine schedule. Risk versus benefit. This can be based off of their history of reactions, or this could be like an immunocompromised individual. So is it more risky to get the vaccine or more risky to not get the vaccine? And this is a conversation that the client has to have with the physician. If a client has a current severe illness, like a common cold or minor illnesses are not usually a concern, but if they have a severe illness, bronchitis, pneumonia, things like that, then they want to wait to receive their vaccine until they have recovered from that situation. Their immune system is already working hard, and so we don't need to overwhelm their immune system by introducing something else. And actually, commonly when you go to get your flu shot, it's even on your predetermined questions if you are currently experiencing viral symptoms or infection symptoms, that if you check any of those things, then the pharmacist will tell you no. You'll have to come back later. Tdap or Tdap is the tetanus vaccine. If it has the P in this instance with the Tdap, then it also has the pertussis. So you'll see it has tetanus, diphtheria, pertussis, and all mixed in together. So there's 3 different types that's in this vaccine. This can cause a mild reaction up to severe reaction, so you need to know the difference in types of reactions so you can properly educate the client. So if they come in or call about these complaints, the mild reactions, you can just let them know that if this is common, it's okay, it should usually go away on its own, but if it progresses to these symptoms for the severe reaction, that's when you need to go to the emergency room or come back in or do something immediately before that. So that's the difference in what I want you to focus on here. So with your Tdap vaccines, Mild reaction is going to include redness, swelling, and tenderness to the site, a low-grade fever, and perhaps behavioral changes like drowsiness, irritability, or anorexia. Moderate reaction is going to be if they're crying for more than 3 hours, so like children, a fever of 105 or more, or they've experienced a seizure or shock symptoms. Of course, they need emergency attention. A severe reaction is going to be acute encephalopathy. So this is affecting the brain function and can disrupt brain function for the future as well. So this can be quite damaging to the brain. If the client has a history of previous reactions with dosages, then maybe they shouldn't get another one. If they have Guillain-Barré syndrome, any progressive neurologic disorders or uncontrolled seizures, then perhaps they should not get this version. There is available tetanus without the diphtheria and pertussis, and sometimes they can tolerate that a little bit better. HIB, Haemophilus influenza type B. Adverse reactions are going to include redness, swelling, warmth, and tenderness, and that's supposed to be 101.0 fever or higher. So you'll see that most of these are going to have redness, swelling, warmth, and tenderness to the site because you broke the skin barrier, right? So it's hurt the inflammatory response, the immune response, everything's going on in that local area. So that's common because you gave them a shot. However, if an infant is less than 6 weeks old, they should not get this. They don't have the immune response to do this yet, and should not be considered for the HIV vaccine yet. Rotavirus vaccine. This can cause adverse effects including irritability, mild temperature, diarrhea or vomiting, and intussusception. This is a GI disorder where the intestines folds in itself. We'll get into more of that in second and third semester. They have a history of the intussusception, sickle cell disease, chronic GI diseases, spina bifida, bladder extravasity, so the bladder is outside of the body, or any immunocompromised state. They should not receive the rotavirus, or at least have an extensive conversation with their doctor of risk versus benefit. Inactivated poliovirus, adverse effects are going to be tenderness at the site. If they have an anaphylactic history to neomycin, streptomycin, or polymyxin B, they should not take this vaccine or have that conversation again with their physician, because it uses these as to keep it from becoming unstable. It's what's the word? Yeah, I'm gonna move on. So it's in the vaccine. So if they have a history of anaphylactic reaction to these, then of course don't give it to them. But the poliovirus contains these as a stabilizing agent. So make sure that they are aware of that. Also, clients that are pregnant should not receive the inactivated poliovirus due to their immune system's already quite overwhelmed, and it's can interfere or interact with the fetal development, I guess is the better word. The MMR vaccine includes the measles, mumps, and rubella. Mild reaction will include the rash, fever, swollen glands in the checks. Ooh, I combined those words. Cheeks or neck. Moderate reaction is going to be joint pain and stiffness for several days or weeks, febrile seizures, and a low platelet count. These are when we start to be concerned. However, severe reactions include transient thrombocytopenia, so a low platelet count, so they could bleed out. If they start to develop any onset of deafness, hearing loss, that is a concern. Long-term seizures, so not just one seizure, now they're going to be continuing to have seizures, so it's not just a one-time thing. And then brain damage can occur. So there's a lot of bad reactions with the MMR vaccine, so we need to be wary and cautious of these. If they already have a history of thrombocytopenia or thrombocytopenic purpura, if they have an anaphylaxis to eggs, gelatin or neomycin, these are used, it's the protein that's also in eggs is also the protein that's used in this, and the gelatin and neomycin are used as those stabilizing agents. So it is included in the MMR vaccine. So if they have an allergy to eggs, they should not get an MMR vaccine. If they've had a blood transfusion with antibodies within the last 11 months, they may not know if it had antibodies or not because we don't really educate them on that part of the blood transfusion. But if they've had one in the last 11 months, they need to consider the risk. And if they've had a concurrent TB skin testing in the last recently, and it's in that first 3 days where you're wanting to look to see for any reaction, they should wait after their TB skin test has been read and determined, or if it was positive, waiting on that chest x-ray, wait for that entire process to be done before they receive their MMR vaccine, as it can interfere with the results, the reading of it. That doesn't mean that it can trigger the TB, but we don't want to interfere with the results of that, interpreting the results. Varicella vaccine. Mild reactions include tenderness and swelling to the site and a rash that could last up to a month. Moderate reaction, seizures. And then severe reaction is going to be pneumonia, so cough, elevated white blood count, fluid on the lungs, difficulty breathing, low oxygen sat. That's all pneumonia may look like before you can get a chest x-ray to confirm it. A low blood count, so if their white blood cell differential is resulted to be low, it can have, that could be because of the immune response. It is attacking the immune system. And we didn't want that. That's not what we gave it. So we need to be monitoring and watching for these issues. And then a severe brain reaction. So if they have any like change in level of consciousness, they start acting really weird or paranoia or anything that changes mentality-wise, that could be a severe reaction. If they are pregnant, I know this says history of and then being pregnant. Not that you've ever been pregnant, just that if you are currently pregnant. Anaphylaxis again to the gelatin or neomycin, blood transfusion in the last year or 11 months, and an antiviral medication within the last 24 hours prior to getting the varicella or 2 weeks after. So they should make sure that this is not concurrent with an antiviral medication. Also, if they're taking corticosteroids or history of cancer, this can interfere with the immune response. Immunosuppression and getting a varicella vaccine may not be a good idea. Pneumococcal vaccines. This can cause some adverse reactions of swelling and tenderness and redness, some little bit of fever, irritability and drowsiness. Now you'll see here the irritability and drowsiness is not like a super concern in anorexia, whereas in other areas it can be quite a bad concern because it could be indicative of a worsening problem, whereas this should not get that bad. So it's an okay reaction in this case, but not an okay reaction in other cases. So take note of that. Also, so anorexia and myalgia. If they have a history of anaphylaxis to the diphtheria toxoid vaccine, so the Tdap, if they have a history of issue with Tdap, the pneumococcal vaccine, they might also have an issue with. Children, yes, less than 2 years old, or if they are pregnant, then they might need to get the polysaccharide version of pneumococcal vaccines. Hepatitis A and B can include concerns of tenderness, headache, anorexia, malaise, and mild fever. If they have a history of an allergy to latex for hepatitis A, they should not get that vaccine. If they have an allergy to yeast, then they should not get a hepatitis B vaccine. If they're pregnant, hepatitis A may not be good for them to take right now. Just wait until they're not pregnant anymore. And then infants that are less than 2 kilograms, yes, less than 2 kilograms, so like premature infants, they should not get the hepatitis B vaccine yet. They should wait until they're a little bit older. So this is usually one of the first ones that an infant gets after they're born. We'll see that later in the fall semester. But if they are too small, they should not be getting the hepatitis B vaccine yet. Activated and live influenza vaccine. This is your flu vaccine. Adverse reactions are going to include swelling, redness and tenderness, hoarseness, fever, malaise, headaches, aches, cough, vomiting, diarrhea with the live version, and then nasal congestion and runny nose with the live version. If they've had these reactions in the past with the live, then maybe next time go with the activated. If they get a flu vaccine, it could increase their risk for the Guillain-Barré syndrome if they get the inactive version. But then seizures can occur with the inactive version along with the pneumococcal vaccine or the Tdap vaccine. So our education or things here is that to take the flu vaccine away from other vaccines at its own time to decrease those risks. If they have a history of Guillain-Barré within the last 6 weeks, then don't do that. And then any antivirals, chronic conditions, or if they have an allergy to eggs, they should not get the live vaccine. Meningococcal vaccines. Adverse reactions include redness and tenderness and fever. And then the human papillovirus, version 4, 9, and 2. Adverse effects are going to include redness, swelling, and tenderness, a mild to moderate fever, headache, fainting, fatigue, nausea, vomiting, abdominal pain, and myalgia. This last line is only going to be true for the HPV-2 ones. If they are currently pregnant and if they have an allergy to yeast, 4 and 9 should not be given, and an allergy to latex, number 2, should not be given. Zoster can include adverse effects of redness, edema, itching, and tenderness, and headache. If they have a history of immunosuppression or immune-altering drugs, then zoster vaccine may not be good for them. This is another time that risk versus benefit should be a topic of conversation between the client and the physician. All right, so that completes all of the vaccinations for medications that affect the immune system. Other medications that affect the immune system include chemotherapy drugs. So these are going to include anti-metabolites such as methotrexate. We've seen this one before also with treatment of like rheumatoid arthritis in the musculoskeletal area and how this affects the immune system. Anti-tumor antibiotics, antimitotics like paclitaxel, alkylating agents, and topoisomerase inhibitors. Concerns of chemotherapy medication are going to be pretty much the same. Alopecia, so losing of hair, bone marrow suppression, so their blood counts may be affected and need to be monitored frequently. Tissue damage, especially if it's given in an IM or sub-Q route, that localized area should be monitored frequently. Chemotherapy medications also have a lot of concerns of GI discomfort, nausea, vomiting, and usually are given adjunctively with antiemetic. Organ toxicity can be common with these medications, so these need to be monitored frequently for their levels to make sure that they are maintaining therapeutic and not toxic levels. Can also cause cardiac problems, and this is going to be dependent on the type of medication, but just so it can include increased heart rate, decreased heart rate, increased blood pressure, decreased blood pressure, it can cause arrhythmias, not antiarrhythmics, I tried to say, arrhythmias, so abnormal heartbeat, heart failure, things like that. So any type of cardiac problems, it's going to vary. So getting monitored frequently and reassessed frequently is going to be key with these clients as well. The big thing that's more of an education due to home life is going to be their immunocompromised state. Their chemotherapy medications are going to cause an immunosuppression, and therefore they're going to be at a high risk for infections. This means that we need to give them education about washing their hands, not going out in large public places, especially right now with the coronavirus going on. They're going to be easily catching any little cold, virus, bacteria. If they get a cut or scrape, watching and cleansing that area frequently to make sure it doesn't get infected, those types of things. Good cough hygiene to make sure they don't develop pneumonia, and education similar to that. The other concern is sexual dysfunction, so they may not have as active sex drive, they may become impotent, they may dry up for females, so then it can be difficult or painful to have intercourse. So education to those needs to be made aware to the clients. If the client is currently pregnant or has any organ dysfunction, we may need to consider reducing the dose for the organ dysfunction so that we don't cause toxicity. Alrighty, your lecture came from pages 327 to 350 in your textbook for the ATI pharmacology. If you have any questions, we'll be reviewing these as well as the musculoskeletal items in class on Monday the 25th, I believe. And so bring your questions to class then. Thank you.